Well, today we're going to be talking about working out, but now if this isn't the most confusing handout ever, in a couple of minutes it's going to be very, very clear. You follow this, you can reverse disease. Cool, huh? I know. Well, today we're going to talk about working the body. Now, working the body is not any different than working the mind. If your body isn't working right, your mind's not going to work right. Do we have an epidemic of Alzheimer's? Yeah, that's why we're going to be talking about brain health coming up in February, about the February 14th. But when you look at this, and this is at the American Psychiatric Association, they say you cannot separate physical from mental function. So if you have a sedentary lifestyle, you're going to have a sedentary brain. It means your brain's not going to work right. So I don't care if you have a reasonably healthy diet, if you're not moving, your brain's not going to function correctly. So this is vital. How many people in here would like to have a fully functioning brain? Okay, good. Yeah, so movement's vital. Now, remember, I taught anatomy for 8 years. So when I talk about anatomy and physiology, you have to look at the different types of muscles. We're going to talk about working them, but there's basically 3 different types. Skeletal muscle, smooth muscle. Now, skeletal muscle is everything that you normally think of a muscle. It's the steak that you would eat. Smooth muscle, these are the muscles that you don't even think about. They have automatic control. Okay, and that's why when you eat that apple, there's actually a muscle or a muscular wave that has this smooth pulsating muscle called peristalsis that moves that through your body, and you don't even have to think about it. There's also muscles around the lungs. And the heart muscle is amazing. Because do you need to rest muscles? Not the heart. It goes from 5 weeks after conception for the next 120 years. It never rests, never stops. It's fantastic. So when you look at this, some of these muscles need rest, some don't. Now, if you've ever been told, well, you know, I have this tight muscle in my back, and it's tight all the time. It's been tight for 2 weeks. When I sit, it's tight. When I stand up, it's tight. Is that a muscle problem or a nerve problem? Don't answer. Okay. Because you're going to find out how that works. Well, let's look at smooth muscles first, because we're talking about working muscles. Now this thing, what's interesting, you got to look at the nervous system. When you're talking about the automatic muscles, these are muscles that control digestion, respiration. You don't have conscious control of them. And in fact, there's blood supply that goes to them and nerve supply. Now, we can interrupt these muscles. Ha! Did I just... I wanted to interrupt the muscle. Okay, did I stimulate fear? Okay, good. I stimulated the fight or flight response. What that did, okay, only the first row really got it. But you know, so right now, where's your heart rate elevated? Yeah, so what we're looking at is the automatic response, the fight or flight system. If this is responding or you're under pain, physical, chemical, I just did emotional pain, okay? So any one of those 3 pains, smooth muscle shuts down. So now think about this. If you've got physical, chemical, or emotional stress, you don't have healthy digestion. If you can't digest food, you start to store it. So that means weight gain. If you don't have appropriate function of the lungs, you can't get good oxygen transfer. That means the brain doesn't work right. Now, this stress response is vital to keep you alive in the short term. But if the stress response remains, your body breaks down. It breaks down pretty quickly. So now let's look at skeletal muscle. Now skeletal muscle, and this is for the anatomy lecture, you know, when you're going to pass your boards. What's the functional unit of a skeletal muscle? Say sarcomere. Sarcomere. Okay, good. Now that's what it is. If you look at this, now you've all seen a steak. Now a steak is a whole bunch of little tiny sarcomeres. Okay, we're talking millions of them. Now what they look like, they're little actin and myosin filaments, and they have like little fingers on them. Now if your fingers are like this, they're not that strong, right? If I'm trying to pull them apart, they can pull apart easy. Now if my fingers are like this, it's hard to pull them apart, right? Well, that's the same thing with muscles. Now when your muscle is stretched out, okay, is your muscle really strong in this? No, it's not. And in fact, try it. Stretch your arm out really, really as straight as you can. Now try and bend it and resist it. It's really easy to resist, and the reason is because these actin myosin filaments, when the muscle's stretched, they're barely contacting. Okay, now bend your arm a little bit like this. So now all the sarcomeres are there. Now try and resist, push down, and pull up. Okay. And the reason is the muscle isn't stronger, there's just more actin-myosin filaments in contact. Okay, so what that means is when we think about working muscles, start thinking about working the whole muscle. And what they're learning now in physiology is that to work the muscle through the entire range of motion, you're not going to get as much work. You're not going to burn as much calories. You're not going to get as much energy. You're not going to get as much benefit as if that muscle is slightly contracted and you're moving it through a shorter range of motion. Isn't that interesting? Like have you heard of lactic acid? Okay, well, back in the 70s, they used to think lactic acid was bad. And what happens is, see, this muscle burns oxygen. Okay, like your car burns gas. So if you start working it and you're not breathing during your workout, okay, what do they say in yoga class? Have you ever had, breathe. Okay, which is hard when you know your legs up like this, your body's like this, and you're in an odd position to breathe. Yeah, right, okay. But you have to in order to oxygenate the system. Now, if this doesn't get enough oxygen, it starts to produce an acid, lactic acid. That's called anaerobic, or it's a type of work without enough oxygen. Now, what they did back in the 70s, they tried to think smarter than the body. They would give these Olympic athletes sodium bicarbonate, okay, which would make them feel better. They wouldn't be sore, it would absorb some of the lactic acid. However, their performance fell. Their performance was horrible. So it turns out that lactic acid is beneficial. Think of this, it's almost like your body's smart. Wait, the body is smart. Because lactic acid, what it does is it increases endurance of this muscle, and it also increases reaction time, stretch for fiber. So when you look at this, now there's two types of muscles, skeletal muscles, postural and phasic. Now, phasic means it's for movement, okay, and you get conscious control over those. You can tighten up your abs, you can tighten up this, you can tighten up that. But the postural muscles, you can't. You don't have conscious control over. And that's huge. So when we look at this, postural muscles are for strength, or for balance. Phasic muscles are for strength. Okay, now you might say, well, what's the difference? I know, he's one of my favorite characters. So the postural muscles function under proprioception. And I know I'm tossing out a bunch of words, but if you understand how to exercise, how to move this, you're going to find stupid stuff that you've been taught isn't correct, and you're going to find smart stuff that is correct. Now, postural muscles, proprioception is your body's position in space. So right now, if I'm standing normal, this is anatomical position. Like, you know, you've seen this. This is the Da Vinci Man. And the reason this is anatomical position is because everything's straightened up. Now, if you were to rip my skin off, hopefully I'd be dead first. But if you have a cadaver like this, you'd see everything's pretty much in alignment. Okay, the muscles are in line, the nerves are in line. When you start turning it, the muscles start to turn around. But if the head, now the postural muscles run down either side of the spine, if that head goes forward, those postural muscles start to tighten up. Now, I can't control it. Okay, so the postural muscles are not in my conscious control. And this has to do with back muscles. It has to do with a lot of muscles that you don't have conscious control over. So if those remain under tone, it has to do with one of two things. Either the nerves are pinched or your posture's off. Okay, does that make sense? So when I see people at the gym exercising their back muscles, okay, because they're tight, or they say, yeah, this back muscle here, it's tight all the time. I went to the massage therapist and they get it. If I have a posture like this, do you think my shoulder muscles are going to be tight? Yeah. They have to be. They're trying, my head's trying to be repositioned so it could restore nerve supply. So this thing's huge. Then you look at this, also postural muscles, and this is the muscles that run on either side of the spine, they increase under tone. I don't want to scare you again, but you've seen the picture. Have you ever seen a cat under stress? Come on. Exactly. Think of Halloween. Like that, okay? Human beings are the same way. Under stress, these muscles that run down either side of the spine, physical, chemical, or emotional stress. So does this mean if this person has the Diet Coke with the cheeseburger at McDonald's and the French fries, they're getting trans fats, they're getting absolute toxins, they're getting pesticides, they're getting estrogens, they're getting aspartame, okay, they're getting a lot of chemicals. So physical, chemical, or emotional stress, will that spasm out those postural muscles? Yes or yes? Yes. Isn't that interesting? So now you start looking at this and you think, wow, sedentary lifestyle and poison, that means it's not going to work right. So when you look at this, this is a normal posture. If this is the person that you see in the mall, do they have a postural muscle problem? Yeah, they're firing off all the time. Now this is huge because look at the head. The head is normal here, and if you have a normal head position, you're going to be able to move your arms well. If you have an abnormal head position, all the nerve supply and blood supply is choked off. So depending on your body posture, and you can only tell this from, static, you can just take a look in the mirror at it, or you take an x-ray. If this person starts to do arm exercises that are inappropriate, she's going to blow her rotator cuffs, her shoulder muscle. She's going to blow a lot of different things. So you got to start looking at this at the posture, and then you have to gauge what exercises you're going to give them. Does that make sense? Okay, so the thing that drives me crazy, and I get comments like this on the YouTube, because you got to figure, we got over 300 YouTube videos, and I get comments from Tokyo, I get comments from Switzerland, from Korea, everywhere around the world. And I had this one guy said, oh, it's not the structure, it's the muscles that move the bone. Right. Go back to school, learn a little anatomy. Let's up the game here. Do postural muscles have conscious control? No. Do postural muscles have conscious control? No. Good, thanks. Good. My work is done here. No, well, what happens is you got to understand, muscles, you can say they move the bone, but that'd be incorrect. My brain controls the nerves that control the muscles. Have you ever seen a steak jump off a plate? No. So when you're starting to work out, you first have to think of the nervous system supply and why that muscle's tight or why it's not tight. Okay, so the muscle does not move the bone. The nervous system moves it, particularly when it comes to proprioception. And this is huge. Now we're going to talk about force. Okay, force is mass and acceleration. I'm sorry, this is physics. This is one of my favorite subjects. Okay, when you look at this, now we got a couple of things. Now you've all been to the gym. Is anyone scared of the gym, or is it just me? Okay, you see these guys in this like Band-Aid thing that they call an underwear, strap, and they walk in there, got this little thin strip here, you want to go up and say, look, dude, you're done. Your biceps, you don't want them bigger. But what they do is they sit in there and they start doing this workout, 10 reps, and what are you supposed to do? 3 sets of 10 or 15 and this. Okay, well, does that work, or is there something better? When you look at it, what they're doing, they're exuding a force. Okay, they're doing fast exercises with a weight. What I'm going to show you is the latest science is radically different. You can generate the same force by using a heavier weight over slower speed. And this is huge. This is radically different. This means that you can fatigue out the muscles, you can get more work, burn more calories, increase more tone faster. I just like faster, better, easier. Okay, does that make more sense? It makes more sense to me too. Now, there's 2 types of things, and I know I'm giving a lot of terms, but if you understand this, you're going to be educated. You get educated, you're going to be healthier. Now, a muscle, when it gets smaller, and the more those sarcomeres get in place, that's called concentric contraction. It's getting smaller. When a muscle goes away from you, that's called an eccentric contraction, where it's getting longer. Now, what they're finding out, and this is radically different, and we're talking just in the last few years, muscle builds stronger and faster, and you burn more calories if you have that underweight when it's going away from you. Wow, isn't that cool? So what we're doing now, and we're hooked up with a couple of trainers that are doing this, using very high weight, very, very slow speed, okay, and not sets. You do 1 set. 1 set means you're doing it. Now, I recommend 10 to 15 seconds concentric and 10 to 15 seconds eccentric, if you can do it. And if you can do this for about 1.5 minutes to 2 minutes, I've got to tell you right now, remember, do the muscles burn oxygen? Yeah? You're going to be breathing like it's Lamaze class. Okay, so imagine this. You have as weight as much as you can pick up safely. You never lock out the joint. Okay, and this has to do with legs, with hips, with any area you're going to work on, and you slowly move it out. So you grab that weight and you count to 10 seconds. So it's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then you go 1, 2, 3, 4, 5, 6. Okay, can you see this? Okay, can you imagine this? Okay, so I'm telling you, after about a minute, minute and a half, you're only going to do about 3 or 4 reps, so the joints are saved. So it doesn't matter if you have old arthritic joints. They're going to be very, very healthy. Okay, and you're going to get a better workout. So high weight as high as you can, as slow as you can, which builds control, and you only need to do it once. Now, this type of workout's radically different. You get guys that work out every day. If they're working different muscle groups, that's okay. Okay? For me, and if you're doing this, you're damaging muscle tissue. And you want to. You don't give it time to rebuild. You want to damage it, you want to rebuild it. You damage it, rebuild it, damage it, rebuild it, and that builds it up. Okay, it builds it up rapidly. So this, you can only do it maximum of 3 days a week. You got to do it a day, then rest a day. Do it a day, then rest a day. Okay, does that make sense?
Yeah, so in other words, on the reverse band, you want us to go up 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 with much weight and then bring it down.
Exactly. Okay. Now, the neat part about this, it's a pretty big ego boost because you start maxing out machines. I mean, that's kind of fun. Okay, now, the standard rep is, they're doing it rapidly. Okay, now that's a problem because now let's say that you're starting off with, say, maybe a 5-pound weight, okay? Or let's say you've been doing it longer and you have a 20-pound weight. Or let's say you're doing it really long and you're doing it like a 50-pound weight. Okay, so whatever level you're at, if you go in there and you're doing the regular sets like you see at the gym, what you're doing is you have momentum. Okay, so you'll see them pick it up like that, and they let the weight carry it up in the air, and then the more sarcomeres are attached, and then they can lift it up further. Can you see this? So they're not really getting the workout. So what they're doing, and you'll see everybody, even the big workout buff guys, they'll actually go like this. Okay, well they'll throw their body up, let momentum take it, more sarcomeres will get attached, and then they'll do it. And then they built bars and stuff where they can do it. But even then, you can throw it up. So this, if you do it slow and accurate, okay, you get more workout better, faster. Okay, you're going to burn more calories and build muscle better. Now, what's neat about these two gals, they're actually doing it on top of an unstable surface. Every exercise, if it's done on an unstable surface, you're going to work everything else. Okay, this again, it works proprioception. Because if you're not stable, you're always going to be adjusting your butt, you're going to be adjusting your spine, you're going to be adjusting your glutes, you're going to be adjusting everything. So she may be working here, the pecs or this chest muscle group, but also she's going to be working her core. I mean, I like spending like days at the gym. Okay, I go to the gym 3 days a week. Okay, my workout lasts 2 hours. Okay, but that's also, like 15 minutes in the sauna, it's about 15 minutes swimming, it's about a half hour working out, and the rest of this time I'm primping myself. So you look at this, and you can do the entire workout, an entire body workout in about a half hour. And it's effective. Okay, does that make sense? But also, when you're looking at this, what are their head positions? Now just take a look. Is their head down or is their head up? Because that's huge. Because when you look at this, we also have to look at resistance training. Now, this is some of the best and some of the most dangerous ones that you can do. Now, resistance training just means you're going up against a little weight. Now, can everybody in here walk, say, maybe 10 minutes? Yes. If you can't walk 10 minutes, let's say you've got some type of surgery or hip problems, can you move your arms for 10 minutes? Yeah, you can do it. Yeah, I've got to tell you, I've got quadriplegics. I've got them working out. Okay, so you can always find something that you can do. Okay, don't look at the stuff you can't do, look at the stuff you can do. In a 10-minute walk, you take roughly, and this is an average pace, you take about 1,000 paces. In 10 minutes, you take 1,000 paces. Now, what if you had a 1-pound weight in each hand? Anybody good at math? 2,000 pounds in 10 minutes. Okay, now you'll see people walking and they'll walk incorrectly with weights. What they'll do is they'll walk just like this. Okay, now am I initiating this muscle group? No, it's just like this. Okay, so what you want to do if you're walking with weights and walk 10 minutes, you want to rotate your palm forward and you want to go back completely so it looks kind of like a German soldier walking, but you're going to be walking like this. So you get the whole triceps going back, you get the posterior deltoid going back, you get the rhomboids firing off, you come this way, you get the pec coming off, you get the biceps coming up, then you're working all of the agonist-antagonist muscles, which is muscles on the front, muscles on the back. So you start walking like this for 10 minutes with 1 pound weight. That's just a can of green beans. Hopefully they're organic. You know, so you get that. That's 2,000 pounds that you're lifting in 10 minutes. Does that make sense? So any type of resistance is going to be ideal, whether it's bands, whether it's leg weights, whatever. Now, there is some dangerous stuff to this. Now, you might say, well, I don't have any money for it. Okay, I love this. Tea kettles. Okay, she went out. Tea kettles are about $5. You probably already have one. Okay, go to the, Goodwill and you can pick up a couple of them. Fill them up with water, and you can do any type of workout, curl, anything with them. But also, when you look at this, what's her head position? And you got to think about this because all the blood supply and nerve supply comes out of the base of the neck that supplies that shoulder area. So if your body position is appropriate, you're going to have full blood supply and nerve supply. Now the ankle weights, one of the best therapies I've ever developed. Now my history, I was run over by a car, had both my legs broken, my chest fractured, my front teeth knocked out, my skull fractured, and a couple of organs bruised. So when I talk about recovering from chronic injury, I speak with great authority. So when I say that ankles can regrow, that cartilage can regrow, that knees can be regenerated, they can. Okay, they absolutely can. But however, this I don't recommend. See what he's doing, he has a weight on his ankle, which is great, but he's extending it up too high. See, there's two types of exercises you want to do. If you have joint problems, particularly in the knee or the shoulder, which, they're commonly injured, you want to only open up that joint. Now I'm going to demonstrate a great knee hydration exercise right in front of you to regrow cartilage and strain the joints. Want me to do it again? Did I do it too fast? Okay, no, what I'm doing, I'm walking. See, my leg is swinging through the air. And that means that knee joint opens up and separates. When that knee joint opens up and separates, you're straining, you're creating a negative pressure inside of that joint. That creates more blood to flow into there, a superfiltrated blood, and that blood actually hydrates. It produces a fluid called synovial fluid that enriches the cartilage. And then that leg, since it's so big, it opens up and strains those ligaments. You strain the ligaments, it rebuilds. So what we recommend, and you'll see it at our office a lot, is just dangling the leg. And all they're doing, they're moving that leg no more than like this. Okay, it's kind of like what your dad used to do. Yeah, it's broken. No, you just want to, imagine if this was the knee. So you're not lifting it up, but you have a huge weight on it. The more weight, the better. Okay, we recommend between 5 and 15 pounds. So this way, and you have to do it both sides. I don't care if you have an injury on one knee, and the reason you do it, and you always, anytime you're working a joint, you have to have one side up, one side down. One side up, one side down. So your legs, I don't know if this table would support me, but imagine my legs going just like this. It's called a cross-crawl mechanism. What that does, that stimulates the nervous system to heal the joints faster. Okay, always. You never want to work just one joint at a time. Now the ankle weights, phenomenal, but you cannot wear them when you're walking. Okay, they're dangerous. Okay, if you wear them when you're walking, you have to be careful because the knee doesn't work like a hinge. It actually works like a screw. Okay, it looks like it's a hinge, but it's not. Okay, this knee is actually moving twice as much on the inside as it is on the outside. So if you wear an ankle weight, and let's say you turn a corner like this, standard, right? You can wrench that knee and cause a tremendous amount of damage. Now when I talk about knees, I've dissected over 500 of them. So when I talk about the mechanics of the knee, this you have to know. You can walk with weights, and if you do walk with weights, okay, you're going to take 1,000 paces in 10 minutes. If you come up to a corner, you have to stop, then go again. Okay, you have to be so careful, like your knees are going to explode, even if they don't hurt. So that, one of the most dangerous exercises you can ever get, one of the most beneficial exercises you're ever going to get for the joints. Now the shoulder joint. How many people have shoulder problems? Virtually everybody. Okay, everybody, you have to. Okay, why? Because what body position do we have? This is pretty much driving, computers, TV, video games. Okay, so what that does, if that heads forward, it chokes off the blood supply and nerve supply to the shoulder. Now there's 4 muscles that hold this bone here. It's called the humerus, although it's not real funny. It's called the humerus inside of this little cup. Now what's interesting with the shoulder, you've got this humerus in this cup, and it's incredibly mobile. Now you've got these 4 muscles that attach it, and they do some action. They move it out, in, and up a little bit, but their main function is to drive that bone, suck it into this socket, and they do a phenomenal job. However, if the head's forward, blood supply is choked off. Now since you got these 4 muscles, it's choked off to the topmost muscle. Guess what the most commonly torn muscle in the rotator cuff is? The supraspinatus, the top one, the one at the top. And 100% of the time, there's forward head carriage involved. I can't tell you how many hundreds of patients I've had with shoulder injuries, and they say, yeah, you know, they've been working on my shoulder for months and it just doesn't work. You know, I've been to the physical therapist for a long time, you know, and he just not do it. They put electrodes on it. You know, I go, dude, come here, let's get an x-ray. You know, why? Because you can't work on something. If your head's forward, it's like working with a tourniquet. That's stupid. You cannot fix a shoulder unless you pay attention to the neck. Does that make sense? Yeah. Now, this is the weird one, okay? If you have, because remember, the main function of those muscles is to suck that bone into that cuff. Now, let's say that you tear one. Guess what? The shoulder doesn't fall out of the socket, it falls up. I know, but you got to know why. Because you got this massive deltoid, this giant muscle that's over here that's always exerting that pressure going up. So if you have a torn rotator cuff, you can carry a purse. If a guy's carrying it, it's a bag. Okay. I know, because I did an experiment and I carried a purse in Chicago and it was really heavy. But you know, you can carry it, it's fine. And here to here, you're strong. But if you have a bad rotator cuff, right about when you get to here, it's going to hurt. You get to here, it's going to hurt really bad. Because what that's called impingement syndrome. So what you want to do, how do you fix all shoulder injuries? How you fix all shoulder injuries? First, you got to restore the head position. That restores blood supply and nerve supply. Then you have to reform the socket. And what you do is you turn your palm forward and you just pendulum it. You go back as far as you're going forward. And the reason you turn your palm forward is because that rotates this bone inside of the socket, and you actually reform. You reform the labrum. You reform the socket. It's the most amazing exercise ever. But remember I said you got to work both sides? So you got to work both sides at the same time. Now this is the hardest exercise. Okay, now I've tried to explain this 1,000 times. What you do to work the shoulder, the elbow has to be locked, the palms have to be forward, and you go back as far as you're going forward. And you have to have a weight. Any kind of a weight. I mean, shoulder injuries retire chiropractors, and I see a couple hundred people a day. I want to do this for decades after decades. So for me to do it, I know my shoulders are at risk. I use about 20 pounds of weight. Okay, I do it 3 days a week to make sure my shoulders are strong, and they are. Now, you may want to start off with 3 to 5 pounds, but you have to have your palms forward. That rotates that in there. You have to have a weight. It drops it down. You have to move it back and forward. Now, this is a ligamentous exercise. It's not for muscles. But if we're going to work the muscles, you've got to have a healthy one. Now, I found this is the closest thing I could find in a workout book, but his palms are internally rotated. That's stupid. You know, one of these days I'll write an anatomy book and show people how to work. But this thing, the palms forward, back and forth, just like that. Does that make sense? That, as long as you're fixing the neck, you'll have 100% success. Now, why is this guy bad right here? Why is his workout bad? What's his neck position? Yeah. This guy, I know, he loves his bicep too, but he shouldn't be looking at it. Okay? These guys are doing it perfect. Why? Because they understand that position of the chin is vital. And then again, if you do a slow concentric and eccentric contractions, okay? Not locking out the joint, you're going to get a better workout. These guys are at risk of damage, those guys aren't. Does that make sense? Okay, so it's vital. Yeah, the only other thing is the absolute horrible, you know what caused the Roman Empire to fall? The Roman chair. Now, if you've ever seen it at a gym, okay, it's a horrible thing where it locks your legs in, it has a waist here, and what people will do is they'll flatten out their back, increasing intrathecal pressure, which is pressure in the gut, forcing fluid in the back, and then they put it under strain. I mean, I want to go up there and hit these big workout guys and say, what are you doing? You know, you can't do that. You can't do that. No, you have to have a curve in your back because your spine gets its strength from the curves. So you don't want to do any exercise that flattens it out. This is one of the greatest lymph movement exercises, one of the greatest strengthening exercises. And all you got to do is bounce. And you can bounce on just your calves. You can bounce on a trampoline as long as you get a little bit of movement. And this is where movement comes in. Any type of movement's going to strengthen your body. It's going to strengthen your bones. It's going to strengthen lymph. So let's say that you're watching a TV program. You can sit there and watch it and bounce. Let's say you're cooking. The watch pot will boil eventually. Okay, you can bounce just like this. Okay, it's nice. You're getting a good calf exercise. It'll work. If you want to really bounce, you can do the exercise named after Jack LaLanne. Jumping jacks. Did you know it was named after him? I think that's cool. Yeah, so there's any kind of movement you can do is going to be vital for this. Now this, since breathing is so important, this is a normal side view of a neck, this is a normal front view of the neck. And since breathing is vital, if you can't breathe, you can't get oxygen, you can't burn the muscles. Okay, does that make sense? So I'm going to teach you anatomy. C3, C4, C5 keeps you alive. Say this with me. C3, C4, C5 keeps you alive. Good. You now can pass a board question. What does that mean? That means the nerve to the diaphragm, the breathing muscle. This diaphragm moves. It's innervated by the base of the neck. So any nerve pressure on that means the diaphragm isn't going to work right. So if you have something like this, where we have a reverse curve degeneration, do you think that person has breathing problems? Yes or yes? Yes. Do you think they have forward head carriage? Yes or yes? Yes. So guess what they came in with? Shoulder rotator cuff problems along with a host of other things. If you can't breathe right, you're full of acid because every time you breathe, you're losing carbon dioxide, which is good for you. You move towards alkaline. Now this, yes, you can see the discs are regrowing. Isn't that cool? That's called reversal of arthritis. But if you understand, the body is designed to regenerate. Have you ever been told that arthritis happens when you're older?
Yes.
Okay, that's a lie. Okay, this one's arthritic, this one's not. Are they the same age? I always thought so. You know, I know. When you start talking common sense, this medical jargon is foolish. When you look at this, now this is a cadaver sample, but when you say that the head's forward, if that person has forward head carriage, those joints are literally rotting out. They're rotting out. And this is going to negatively affect breathing. If you don't breathe correctly, does your system's going to become more acidotic. Guess what's popular? What affects half our population now? Starts with a big C. Cancer. Yeah. Almost half our population has it. Why? Because their system's going towards alkaline. And then this. God bless Homer, but you know, there is a couch magnet. I mean, Bill Maher said it the best. I mean, if you look at the cure for depression, it's exercise. You look at good brain function, it's exercise. And he said, ask your doctor if getting your butt off the couch is right for you. He actually didn't say butt, but you know, this is G-rated. So there's a magnet in the couch. You cannot sit and expect to get healthy. If all you can do is sit, you can sit up straight, you can reposition the neck, and you can start working your arms. Okay, does that make sense? Sitting for a half hour a day is great. Sitting for an hour a day is not as good as a half hour a day. Sitting for more than that is dangerous. Okay, so you have to move it. Carpal tunnel syndrome. Have you ever heard of carpal tunnel syndrome? Comes from the neck. It's a double crush injury. Headaches come from the neck. It's a double crush injury. Pinches here and then causes head problems. Sinus problems. Asthma, breathing problems. We already discussed how the base of the neck is involved in breathing. So before you start a work out, should you get your neck checked? You have to. You have to. There's no other way. This is normal posture. You work with this. By gosh, you're starting to see people with humps back here. Do you know what that hump is back there? It's like a fulcrum and a lever. It's a kneecap for your neck. That means that these posture muscles are tight all the time. So when you start saying, oh, my shoulders are tight all the time, my neck, who would turn down a shoulder rub? By gosh, if this person had a shoulder massage and they relax those muscles, which way is the head going to fall?
Straight.
Further forward. It's foolishness to massage a muscle unless you know why it's firing off. It's foolishness. This gal here, I mean, that's her spine going up. She had chronic back problems. Chronic back problems. It eventually worked into depression and worked into fibromyalgia, which is incurable with drugs. But what's wild is her muscles are firing off all the time. They never rested. And you know, there she is 90 days later, cured of the disease. But again, headaches, migraines, all coming from the neck, rotator cuff problems. All of these, the muscles and joints are designed to heal. They cannot heal if you don't have appropriate nerve supply. Now, office work. If I said that my back hurt because I was golfing all day, you would say, poor baby, you were golfing all day, okay? Wouldn't you? There wouldn't be a lot of empathy here? And the reason it would hurt is because when you bend forward, turn, and hit, the pressure on this disc at the base of the spine increases 8 times normal. And if I'm not in appropriate shape, that swinging of the club will start to irritate that disc. Okay, does that make sense? Golfing, bend and turn and twist it. It makes sense. However, what you're doing right now and what she's doing increases the same pressure on this disc 5 times normal. Wow. Okay, so you guys right now are destroying those discs at the base, but you don't feel it.
Should we stand up?
Well, not yet, but, you know, almost, okay. See, the problem is when you sit, you open up the nerve holes in the back. So it feels good, okay, but you're damaging the discs. That's why this is the only type of chair that we recommend. It's called a ball chair. You know, you've seen those beautiful ergonomic chairs at at Staples. They're like $400 or $500. They don't work because when you're sitting there, they've got a lumbar support. When you first sit in the chair, it feels good. But what you need is you need this unstable surface, so you're always trying to adjust your body posture, and that adjustment of the body posture keeps fluid in that disc. It's the best chair around. You can get them for about $70, $80 at Target, and we get them online at Guillaume. I mean, it's a fantastic chair. You can even order these, if you work in a giant cubicle type thing, tell them, I'll send them the biomechanics on it. It's one of the best, cheapest chairs out there. This is our goal, okay? We're not supposed to age. Yes, sir?
I actually have 2 desks, and one has a ball chair, and one I just have a giant exercise ball. I like the ball by itself much better.
Yeah, and what's neat about that, the ball chairs are literally an exercise ball with wheels. And he just likes sitting on the ball. And what's neat with that, you're going to get a better workout because it's a less stable surface.
And the ball is too stable in the chair.
I got to tell you, if you can survive on that, that's better because your legs are going to be further out. It's going to stabilize the pelvis. It's going to be way better movement. The tough part is this is our potential. If you're 80 years old, your joints are only about a year old. If you're 20 years old, your joints are only about a year old. Your joints are designed to be healthy. This is a crime. I've seen old folks' homes. I mean, my mom spent the last year of her life in one. Well, maybe because she thought that breakfast was coffee and an apple fritter. Okay, God bless her, but it's not. Okay, breakfast needs to be something healthy. And we even have appropriate breakfasts on here. Because when you see on here, you're going to see the ultimate workout smoothie. And this is right in the middle, coconut smoothie, workout and breakfast. Why? What does it have in it? It has coconut for rich, healthy, saturated fats. Electrolyte replacement. This is what you need when you're working out. Then you put a little bit of raw cacao in there. That's chocolate, only without sweetener in it. Then you put a frozen banana, which is loaded with potassium, and it actually tastes good. And then you put, a little bit of spirulina in there, so it looks kind of green and cool, but that's an antioxidant. Okay, and then you blend the heck out of that. With a little bit of raw vegan protein powder. Come on. What could be better? Not only does it taste good, it's good for you. I want to show you what normal is, and I want to show you something from 50 years ago. As modern science, have we gotten healthier in the last 50 years or not? No, not. We haven't. With the population, cancers rates have increased, chronic disease has increased, degeneration has increased. Why? Because the advice they're given. I mean, you get somebody with a kidney disease, are they telling that patient to get soluble fiber and healthy nutrients and eliminate grains? No. They're telling that person to take a cholesterol drug, which is foolish. This right here, okay, I showed you what a normal neck is. Does this person have forward head carriage, yes or yes? Now, it's hard to see, but there's actually a little bit of degeneration here. Now, this is 1961. I was 1 year old when this picture was taken. No, it's not me. But this person here, they went in to a medical office, they got an x-ray, they found that there's no forward head carriage and there's advancing degeneration at the base of the neck. They had headache and arm pain. What do they prescribe back then 50 years ago? Pain relievers, okay, would you have muscle spasms? Muscle relaxants 50 years ago? Yeah, that I know it's antiquated and stupid. So you're covering up her symptom and you're making her comfortable while she rots, okay? Now, here it is, 2 years later, she's got more advancing arthritis. We're seeing that progressive degenerative condition. Is this from old age? No, she's got perfect joints up here. It's not from old age. So she handled the symptoms. What are her rotator cuff problems? What's her shoulders like? Good or sick? Sick, okay? Now that was 50 years ago. There it is, 1965, progressive arthritic changes. Her body is rotting out. Even at this stage, those joints can be regrown. Even at this stage, her life can be restored. But no, they can't even get her on an exercise program because she doesn't have appropriate. 1968, this is 7 years after the first one, giant massive bone spurs forming. Now this is not degeneration, this is a protective mechanism by the body. And these fools are not understanding the brilliance of the human body. They just drug her to make her comfortable. Now that's care that's common today. It shouldn't be. 1972, now it's progressing up to the next level. And this is a progressive degenerative condition that's absolutely reversible if it's treated correctly. 1974, now giant bone spurs just rotting out. They're monitoring her. They're saying your body's being destroyed, and they're not telling her that her body's built by God, that it can be re-healed. They're not telling her that she should change her nervous system. She should change her proprioceptive firing. She should cause inflammation there. By gosh, they're probably giving her anti-inflammatories. And inflammation's how the body heals itself. Can you see this? Okay, in 1975, now it's progressed beyond belief. Now this is C3, C4, and C5. Okay, this is the base of the neck. What's her breathing like? Do you think she has asthma? Do you think she has depression? Do you think she has anxiety? Do you think she has all of those conditions? Okay, the tough part, could I change that date to 2012? I could. It's the same stupid care. Okay, right now, this is a 68-year-old patient with a 43-degree scoliosis down to 37. 68. Now, what's neat is, you don't know her, but she actually had a stair chair. I don't know, a stair chair, what it is? You sit in this chair, and it carries you upstairs. Okay? Okay, why? Because her legs weren't working. Okay, now she's a grandma. Okay, and what's fun is I told her, I said, well, only your grandkids will be using that because you'll be walking up the stairs. Sure enough, 6 months later. But the biggest challenge with her is, how many medications do you think she was taking in today's society? It was actually 14. She had high blood pressure, she had high cholesterol, had all this other stuff. 14 drugs. Okay, I mean, she's down to, I think, 2. And if she listens to me more, she's going to be off of those. But better, right? 68-year-old? Now, her orthopedic surgeon says, yes, it got better, but it can't get better. It's eventually going to get worse. I know. Honestly, this is the advice that they give. Joints can be healed, arthritis can be reversed, the body can be healthy. Okay, you have to start working out. When you work out slow, heavy weights. Don't straighten up the joints, make sure the joints are healthy, but you got to get the nervous system checked first. Does that make sense? And that's every workout, every time, everywhere. Now, February, we're starting tomorrow. I think, yeah, February is tomorrow. Okay, to get checked at our office, and this is to get checked for the nervous system, it costs $25. Okay, and this covers x-rays, posture analysis, exam, report of findings. If I find degeneration, I can tell you if it can be helped, and we can actually get your body healthy. Does that make sense?
Yeah.
Because that's, and all of these are recorded. Okay, so hopefully we have some physical terrorists that are going to be looking at it, some medical terrorists that are going to be looking at it, and people are going to stop drugging people and actually learning health. Does that make more sense? And that's what's on this. You're going to see juicing recipes. You're going to see warm-up stretches. Ligaments, as you age, do not get more brittle. Bones don't get more brittle. The ligaments of an older person are just as healthy as a younger person. Okay, and that we talked about that last week when we covered bone health. All of these, what you should stretch, why you should stretch, it's just fantastic. If I'm talking to patients, you'll see me moving. You'll see me bending, twisting. And they'll say, do you hurt? No, I feel really good. You know, and I'm moving because, you know, I want to hydrate the joints. And then you have examples of stretches that you can do here, and you'll see these are stretches you can do while your computer's downloading, while you're cooking, while you're watching TV, everything. But when you look at this, there are no symptoms at optimum health. There are no symptoms at death. Okay? So we're not talking symptoms, but anytime you can take a step in one direction or the other. You choose to go by Mother's Market and get a juice, you're taking to soluble fibers, cleaning the arteries, getting your body healthy. You choose the Diet Coke from McDonald's, you're getting aspartame, you're destroying the joints, you're making your body acidic. You choose the orange that I had right before I got here, which was actually pretty darn good. Okay, you're getting soluble fibers, folic acid. Okay, you chose the dark chocolate almond that I also had before I got here. That's a little bit in this direction. It was organic and it was organic chocolate, but by God, you know, that was high in sugar. It's not good. I got balance. The orange was a little bit bigger than the dark chocolate almond, but it was okay. So you can have balance here, you know. I mean, the world is black and white to some people. Yeah, but she's a juice fanatic. Don't talk to her. Okay, so now next week, every second Tuesday of the month, we're going to be back here, actually over there at the new place, okay, and we're going to be doing a new subject. We're actually moving our Tuesday night half hour to health to the office, but next Thursday, the second Thursday, the 9th, we're going to be over there at the new place, okay, we're going to be talking about deep sleep, restorative sleep.
Is this new?
It's almost the new place. It seems like the new place, but it's not really the new place. I know, the new place is just like 2 doors away. Yes, sir?
Is this any different than the one you gave just a couple weeks ago? Was it?
The deep sleep one?
Yeah.
It's going to be really similar, just a couple of slides are going to be different, but almost exactly the same. Yeah, there's going to be a couple of little tricks, but that's about it. Yeah, just sleep. We keep getting, everybody keeps asking about that. And I think because a couple of people fell asleep during the lecture. Yeah, but thank you so much, because honest to goodness, taking time out of your day to come here, this is invaluable, because you guys, I'm training teachers, because you're going to get out there and you're going to tell people, stop taking that Tylenol, start moving. So thank you very much. You guys rock.